Now, we have already dealt in with the history taking of that person, and we have come to know basically what is the thought form, what is the thought content, and what is the mental state of that person. So, this mental state examination, abbreviated as MSE, and then we have the comprehensive method, which is known as the mini mental state examination, MMSE, that has been performed on a person. And now you basically have the patient, you have the complete notes of that patient, a detailed history. As I'm emphasizing again and again, is very important while you're dealing with the psychiatric patients. It's very important to get that detailed history from that person, because the diagnosis is going to be held on according to the points that you have scratched out from that history, or you have dug out from that history. So the history is again very important. The past history, the work history, the relationship history, and then you have the corroborative history from the relatives and the friends and the family physicians or the healthcare physicians that were involved. If he has some legal history or forensic history, that is going to be incorporated in that particular diagnosis that you're going to make about that particular person. In a lot of cases, the childhood history gives you a lot of clues towards the current mental state of that particular person. If he is in a state of frustration, anger, or if he's basically having problems regarding his anger management, it is going to sometimes reflect the childhood that he had. So all of this is again very important, and now we're going to make the diagnosis about that particular person. So the diagnostic summary and writing down the diagnostic summary in a correct way is again very important, because this diagnostic summary is what the life of that particular person is going to depend upon. So you cannot basically be careless while you're writing this diagnostic summary working as a practicing psychiatrist. So it's very important, and I'm emphasizing on this fact again and again, that you write down this history or this summary, diagnostic summary, in quite a detail. So what are the points that you're going to include in this diagnostic summary? The safeguarding is the foremost point that you're going to keep in your mind while you're writing down that diagnostic history. If you have any signs of abuse, you're first of all going to safeguard your patient from that particular kind of abuse. Engagement with the patient is again very important over here, and you're going to engage the cultural, the social factors, the relationships that he has and that the person can be safe with. So all of this is going to be discussed over here in this fourth section. The identification of key presenting features. So what were the presenting features? What were the presenting complaints of that person? How the person presented in the emergency or in the outpatient department is again very important. You're going to write down those presenting complaints, and then you're going to get the details of the history of these presenting complaints in detail. So all of these factors are going to be calculated upon, and then the timeline of the events. You're going to ask the patient about the timeline of the events, and then you're going to compare this timeline of the events with the corroborative history that was taken from a relative or that was taken from a close friend. So the outlines of the histories, they are noted down. The highlight points over here are going to be kept in mind, and the significant mental state findings. So while doing the mental state examination, you're going to comment upon the speech, the mood, the physical appearance of that person, and then the thought form of that person. And then you're going to comment upon the thought content of that person. Then if he's suffering from any kind of delusions, hallucinations, they're going to be highlighted upon when you're writing down this diagnostic summary. The case formulation is then done, and the initial diagnosis is made depending upon all of these key features, including the presenting complaints, the events in his life, the history of these events, and the mental state examination that was carried out. After making the initial diagnosis, the management plan is sorted down for that particular person. Safeguarding of that individual is very important. If you have signs of any abuse, if it is a child abuse that took place in somewhere in the past, or if it is an abuse that is currently taking place, it has to be highlighted. And the key point is to safeguard your patient at this point. If it is a child abuse case, you'll basically report to the child protection authorities. And if it is a domestic violence case, you will report to the relevant authorities of that particular state that you're working for. The abuse can be physical, it can be financial, it can be psychological, or it can be by neglect. So these are the different forms of abuse. Usually we have this idea that the abuse is only of a physical kind, but it can be financial, emotional, psychological, that is also known as emotional. And if the child is neglected by his or her parents, it's again a kind of an abuse that he's suffering from. The psychological abuse is mainly difficult to identify because the person is only abused psychologically or emotionally, so we won't have any physical signs or we won't have any physical findings. But if we take the history in the particular way, in the correct way, this emotional abuse can be dug out of that history. Any signs of abuse are also going to be looked for in that particular case. Signs of abuse can include the unexplained bruises in a lot of individuals, and then we can have the physical injuries in a lot of patients. For example, fractures. It can be the bruising phenomena, it can be the lacerations, the smothering phenomena. All of these phenomena can relate to a particular kind of abuse, which can be of a sexual kind or not of a sexual kind as well. So the evidence of neglect or poor hygiene is again going to reflect towards the signs of abuse. The weight loss is again going to make your way towards the emotional, or it can be a kind of a neglect abuse. Then we can have the financial issues. For example, at the domestic level, the housewife or the children can suffer from the financial issues, the money missing from the account. So all of these can collectively form the kinds of different abuse that the person may be suffering from. The establishing effective working relationships with the patients is again very important over here. The process by which the clinician establishes a working relationship with the patient or their family is very important, because this relationship has to be built upon, and after you have this relationship, only then you can take a good history from the psychiatric patient. Only then he is going to give you the details about his inner or his intimate lifestyle. The effective engagement is again very important over here. And then the patients tell the physical complaints only to a person who empathizes with them. So it's again very important over here. The clinician should have a friendly attitude towards his patients, and being professional at the same time with your patients is again very important. The engagement includes the active listening, reflecting and summarizing the key points, and more open questions have to be asked rather than the dead-ended questions. The appropriate ending of the conversation is a skill, because you're going to start on your next conversation or your next counseling at this ending question or at this ending conversation. So it's again very important to end the conversation in a particular way. So over here, basically, we summarized how are we going to give the diagnosis of a particular psychiatric patient based upon the mental state examination of that particular patient. So that is the end of this section. Thank you for watching sqadia.com.